Sudden cardiac arrest (SCA) is the sudden loss of all heart activity due to an irregular heart rhythm. Breathing stops. The person becomes unconscious. Without immediate treatment, sudden cardiac arrest can lead to death. Emergency treatment for sudden cardiac arrest includes cardiopulmonary resuscitation (CPR) and shocks to the heart with a device called an automated external defibrillator aid. Survival is possible with fast, appropriate medical care. Sudden cardiac arrest isn't the same as a heart attack. A heart attack happens when blood flow to a part of the heart is blocked. Sudden cardiac arrest is not due to a blockage. However, a heart attack can cause a change in the heart's electrical activity that leads to sudden cardiac arrest. Symptoms of sudden cardiac arrest are immediate and severe and include 1. Sudden collapse. 2. No pulse. 3. No breathing. 4. Loss of consciousness. Sometimes other symptoms occur before sudden cardiac arrest. These might include 1. Chest discomfort. 2. Shortness of breath. 3. Weakness. 4. Fast beating, fluttering or pounding heart called palpitations. 5. Rapid or irregular heartbeats. 6. Unexplained wheezing. 7. Shortness of breath. 8. Fainting or near fainting. 9. Lightheadedness or dizziness. If you see someone who's unconscious and not breathing, call 911 or local emergency services. Then start CPR. The American Heart Association recommends doing CPR with hard and fast chest compressions. Use an automated external defibrillator. Call an aid if one is available. How to do CPR. Do CPR if the person isn't breathing. Push hard and fast on the person's chest, about 100 to 120 pushes a minute. If you've been trained in CPR, check the person's airway. Then deliver rescue breaths after every 30 compressions. If you haven't been trained, just continue chest compressions. Allow the chest to rise completely between compressions. Keep doing this until an aid is available or emergency workers arrive. Portable automated external defibrillators, called EADs, are available in many public places, including airports and shopping malls. You can also buy one for home use. EADs come with step-by-step voice instructions for their use. They're programmed to allow a shock only when appropriate. Causes. A change in the heart's electrical activity causes sudden cardiac arrest. The change makes the heart stop pumping blood. No blood flow goes to the body. Heart conditions that can lead to sudden cardiac arrest. The most common cause of sudden cardiac arrest is an irregular heart rhythm called ventricular fibrillation. Rapid, erratic heart signals cause the lower heart chambers to quiver uselessly instead of pumping blood. Certain heart conditions can. Coronary artery disease. Sudden cardiac arrest may occur if the heart arteries become clogged with cholesterol and other deposits, reducing blood flow to the heart. Heart attack. If a heart attack occurs, often as a result of severe coronary artery disease, it can trigger ventricular fibrillation and sudden cardiac arrest. Also, a heart attack can leave scar tissue in the heart. The scar tissue can cause changes in the heartbeat. Enlarged heart called cardiomyopathy. This condition usually happens when the walls in the heart muscle stretch. The heart muscle gets bigger or thicker. Heart valve disease. Leaking or narrowing of the heart valves can lead to stretching or thickening of the heart muscle. When the chambers become enlarged or weakened because of stress caused by a tight or leaking valve, there's an increased risk of developing a heart rhythm problem. Heart problem present at birth, called a congenital heart defect. Sudden cardiac arrest in children or adolescents is often due to a heart problem that they're born with. Adults who've had repair surgery for a congenital heart defect also have an increased risk of sudden cardiac arrest. Long QT syndrome, ALS, and other heart signaling problems. Conditions such as long QT syndrome and Brugada syndrome cause the heart to beat in an unorganized way. If the heart rhythm isn't quickly restored, sudden death can occur. Young people with ALS are especially at risk of sudden death. Long Q. Risk factors. The same things that increase the risk of heart disease can raise the risk of sudden cardiac arrest. These include a family history of coronary artery disease, smoking, high blood pressure, high blood cholesterol, obesity, diabetes, and inactive lifestyle. Prevention. Keeping the heart healthy may help prevent sudden cardiac arrest. You can do this by eating healthy, getting regular checkups, not smoking or using tobacco, being screened for heart disease, controlling blood pressure and cholesterol. Other things that might increase the risk of sudden cardiac arrest include a previous episode of sudden cardiac arrest or a family history of it, a previous heart attack, a personal or family history of other forms of heart disease such as heart rhythm problems, heart failure, and heart problems (PAR).
Thanks for watching. Please subscribe and like this video.